Vijay Kumar sir only.
But Dr. Rakesh doesn't know the sequence. Yeah, so Vijay sir maybe can do it.
Yes.
Vijay sir, can you just make 4 chits of A, B, C, D, and I'll announce the team name, and then you can just pick one chit for against their name and let us know.
I'll do that.
Yes, sir. Thank you.
So Vijay sir maybe can.
Yes, ma'am, we are live now.
Hello and good evening, everyone. On behalf of Team ISPAE, I welcome you all to the Pediatric Endocrinology Quiz. After the preliminary round held on 30th November, where we had 10 teams contesting, today we have final rounds where we have 4 teams. Before we begin, may I please invite our ISPAE President, Dr. Ahila ma'am.
Good evening, everyone. Can you hear me, Zalak?
Yes, ma'am.
Good evening, everyone. It's a pleasure to welcome all of you for the quiz. And it's going to be a very, very interesting program. We have a wonderful team which has prepared this quiz program, and I'm sure it will be full. Would be interested in of this. Right? Of the department and technology at college session. It's my privilege to invite the bus quiz master. I'm sure we have a program of and her fantastic job. Thankful to the team also. Thank program. That also as a today participate in the program.
So, Dr. Ahila, some of your voice was actually breaking, but I think most of it is over. Should Dr. Ashima start now?
Yes.
Yeah, please.
Ashima, she is mute.
Ashima, you're disconnected or mute
Or
she's going to join again.
Ashima's back, I think.
I'm sorry. Some jitters always happen before the program. Okay. So thank you, Ahila ma'am, for that introduction. And I think we are good to go. And now we can start the process of the ISPAE quiz formally. I'll just share my screen. The introduction of related to the modules towards the end, but formally we'll begin with the quiz. So I thank the ISPAE office bearers, Dr. Ahila ma'am, Dr. Rakesh Kumar, and Dr. Sirisha for putting this team together for conducting the quiz today. And I am privileged to invite Dr. Vijay Kumar, who consented to be the quiz expert for today. Welcome, sir. So we have our team, myself, Dr. Ayush, Dr. Akanksha, Dr. Sirisha, and Dr. Jalak, who will be conducting the quiz today. And as Dr. Jalak had mentioned, we did conduct the prelims round of the 10 teams who fulfilled the eligibility criteria. And out of those 10, we had these 4 finalists for today's quiz. So we have Dr. Sukanya and Dr. from AIIMS New Delhi, Dr. Sushil and Dr. Nimisha from HCM Jahangir Hospital, Pune, Dr. Arun and Dr. Sayan from PGI Chandigarh, and Dr. Alapan and Dr. Sandeep from CDER Kanpur. So good luck to all 4 teams. And before we begin, I'll request Dr. Vijay Kumar to kindly allot the team sequence to each of them. So I think, sir, if you can just pick up a chat first for AIMS Delhi and let us know the sequence.
Is it visible? That check.
Dr. Vijay Kumar, your video is off.
I have some problem is there with my video. So I will
Okay,
do
you-
one thing. Hello.
Yeah, you can announce one of
Yes,
the
sir.
team's name to AIMS New Delhi, maybe. Yeah.
Yeah. AIMS New Delhi. It is C.
AIMS New Delhi is C. So second chat for Jahangir Hospital, Pune.
A.
Pardon, sir?
A first.
Okay, Pune is A. The third PGI Chandigarh,
D.
D. And so Kanpur is B.
Yeah.
Yeah, so I will request all 4 teams to please rename themselves as ATCD. So Jahangir Hospital, Pune is A. CDER Kanpur is B. AIMS New Delhi is C. And PGI Chandigarh is D. All on board? Yeah, so I can see that. Right. So just quickly we'll go through the rounds. So we did have a demo run with all the 4 teams. They are acquainted to the rules of the quiz, but I will repeat them each point by point so that there is no confusion. We have a total of 6 rounds. So the first 5 rounds will allow a direct and a pass question. For these 5 rounds, each team will be given one question to answer with 60 seconds to attempt. The question, when it is projected within the time limit, has to be attempted by all teams. And the 3 teams for whom it is not a direct question will be messaging their answers through private chats to the allotted quiz masters, which I'll be just showing up. At the end of the time, the answer has to be spoken aloud only by the team that received it as a direct question. So that would be 60 seconds for the first 5 rounds. If that answer is correct, the team gets awarded 10 points. And for 10 to be awarded in questions which have 2 parts, both need to be correct. So for few questions, we thought that we may not be able to give you any mark if the first part is incorrect. If there's a leading question for part 2, only then the first part will not be awarded. Otherwise, you will be getting 5 marks each for each subpart of the question. If the question is incorrect in total, only then the question will be treated as passed, where the other 3 teams will get 5 marks for correct answer, and this will be informed by their respective quiz masters. Round 6 is a rapid fire question where no pass questions will be allowed to the other teams. There will be a separate announcement of what the rules would be for round 6 when we reach that round. And any question where the team ends up commenting on answering on the open chat will be treated as disqualified. In case there is any controversy related to answer or question in any round, the decision of the quiz expert, who's Dr. Vijay Kumar, will be treated as final. So any questions here from any of the 4 teams regarding the conduct of the quiz?
Okay.
Okay, so are we good to go?
We have someone, Sushil's AI note taker. Who's that?
Somebody has logged in as Sushil's AI note taker. Please ensure
Sushil,
that
it's
only.
you. It's you.
Yeah,
No,
Sushil's AI.
no, ma'am. We have
No,
logged in
who's
only
that? I
via
don't know. Yeah, who's
using
that?
this laptop.
Is it from Ankit's team?
No, ma'am, it's not from my team.
Can you remove this person, whoever he is?
Yeah, because that person isn't answering
Yes,
and we
ma'am.
don't know who is it.
Ankit, will we be able to remove Sushil, like you as the organizer?
Yes, ma'am, I can remove him, but I'm just checking if we can identify, because if I remove, he may never be able to join again.
Okay.
1 second. Just give me.
And can you please remind teams whom to send the messages? Ashwin?
Yes. So moving on to our just the rules. So we have these 6 rounds planned for today, and the quiz master. So as I'll be conducting the first 5 rounds, Team A. So Jahangir Pune would be answering their questions in the type chats to Dr. Ayush directly. Team B, that is CTR Kanpur, would be sending it to Dr. Akanksha. Team C, that is AIMS New Delhi, will be sending it to Dr. Sirisha. And PJ Chandigarh, Team D, would be sending it to Dr. Jhalak. I hope we are all ready and we are all sorted with regards to whom to send as private chats, right?
If you want,
So-
you can send it once to make sure that the message is.
Yes. So all of you can please send a confirmation as to noted or done to your respective quiz masters now.
Ma'am, I had one question.
Yeah.
Yeah, ma'am, like we discussed last when we were discussing 2 days back, like if for some reason the message doesn't go, so it will be C, right, for us?
Yes.
If the
So
message doesn't go,
if there is a lag at internet connection with the quiz master, then team A and B can mutually send their messages. Sorry, they can send their messages to the respective quiz masters. So A can send to B and B can send to A, and likewise to C and D. Yes.
thank you. Thank you.
So I can't see Sushil AI any longer. So I think can we start now?
Yeah, I think yes.
Okay. So we begin with round 1. Best of luck all 4 teams. And this round is on basic sciences. So we'll move in the sequence of A to D. So the first question comes here for team A. So the timer will start as soon as the question is projected, right? So please define the Frankfurt plane for measuring height with respect to 2 landmarks. So please don't speak out the answer now. Wait for the timer to finish as the other teams are typing their answers and sending it across. Right, so the time is up. Team A, can you unmute and say the answer?
Upper border of the external auditory meatus and to the lateral margin of the orbit.
So that is incorrect. That is an incorrect answer. Can we ask the quiz masters to kindly comment on the answers of team B, C, and D?
Team B gets 0 points. They've got an incorrect answer.
Team C?
Team C, incorrect.
Okay. Team D?
Incorrect.
Okay. So I can share the answer. So the 2 points are the tracheion, which is the deepest point in the notch above the tragus in the ear, and anteriorly it's the inferior orbital rim that has to be taken as the second landmark here. So I'm afraid none of the teams scored this correct. So anyways, we move now to team B. So the direct question to you now, team B, is where is the principle of amperometry used in the management of diabetes mellitus? And you have to define or explain the same. So please wait before you answer it aloud. Right, so the time is up. Can we have the answer from team B? Yes.
Ma'am, pass.
Okay, they have passed. So that means we can directly ask for the scores for team B. Dr. Akanksha.
Ma'am, this was a direct question to B, so incorrect.
Oh,
Zero.
sorry, B. Oh, I'm so sorry. Time, score for team C.
It is 0.
Okay, they have not been able to answer. Team D.
Yes, ma'am. 5.
Okay, they have got the right answer. And team A.
Incorrect, ma'am. They have not answered.
Okay, so would you want to read out the answer, Jhalak?
So they have written, given an example of CGM, and this is to convert sugar values to the electrical signals. That is what they have answered.
Okay, so the first part is correct, but whether we award them full 5 marks for converting the signal, the concentration of glucose to the signal, Dr. Vijaykumar, can we give that if they have not really mentioned whether they are measuring the potential, electrical potential between the two electrodes?
Yeah, I think we can give half mark.
Excuse me, ma'am.
In that case,
Yes.
team C also would get half mark.
Okay, so then maybe we can award 2.5 to both teams
Okay.
for
Okay.
that part. Right. So the next direct question to team C. What does the Frisch hypothesis pertain to? And you have to define or explain the same. Time is up.
Ma'am, fetal origin of obesity and diabetes.
I am sorry, that is not the right answer. So can we have the marks for the other 4 teams? Team D, Chalak. Hello.
Yes, sorry. Partially, like, yes, almost. Can we give 5? Should I say answer or at the
Yes,
last?
we can ask Dr. Vijaykumar.
Allah,
If
I
there's a
think
query.
we should hear the answer.
Yes.
So they have written minimum amount of fat which is required for pubertal onset.
Yeah, that is partially correct.
Need for
exact
leptin in
amount.
puberty. The second part, like.
Yeah,
So maybe we can give them 2.5, sir.
2.5, I think.
Okay. Team A.
Ma'am, incorrect.
Okay, team A is incorrect. And team B?
Incorrect, ma'am.
Incorrect. Okay. So, right. So I think team B scored 2.5 for that. Thank you, sir. We next move to the direct question for team D. So what is the role of ghrelin in appetite regulation? And what is the expected change in ghrelin levels in obesity? Right, so the time is up. Team D, please answer.
Ghrelin increases appetite, and the ghrelin basically it is secreted by the stomach and acts on the ventromedial hypothalamus. The expected change in ghrelin levels is it increases in obesity.
Okay, so you've got 5 marks correct for the first part. But for the second part, the levels are actually low and are related to that. Likewise, they're related to long-term regulation of weight. So Team D gets 5 marks for their direct question, and because they answered it. So we will not be awarding any pass marks to the other teams. Right. So at the end of the first round, do we need the scores here? Team
Yes,
A?
I think better.
Yes, sir. Team A, Dr. Ayush?
Ma'am, 0 marks for team A.
Okay, no problem. Team B?
0 marks, ma'am.
No problem. Team C?
2.5.
Okay. And Team D?
Team D has 10, 5 direct and 2.5, 2.5 direct. So 10.
Okay, 10 marks. So no problem. I think that this was just the first round. So wishing luck for the next coming round. So again, this is round 2. So we'll move in the sequence of A to D. So the first question goes here to Team A. So this is an 18-month-old boy who's presented with global developmental delay. The thyroid profile shows a free FT3 level of 6.55 picogram per ml, a free T4 level of 0.70 nanogram per dl, with a TSH of 3.9 on routine investigations. What is the likely diagnosis? And name the specific drug to treat this. So the time is up for Team A.
Allen-Dudley-Herndon syndrome, and the drug is Triac.
Right, so both parts are correct for this question. So you get 10 full marks for your direct question. Okay, so next question for Team B. This is a 13-year-old tall girl who presents with concerns of puberty. On examination, there is some axillary hair with a breast stage of 2 and a pubic hair staging 2 with clitoromegaly. Ultrasound pelvis has shown a prepubertal uterus, but enlarged cystic ovaries. On labs, the thyroid function tests are normal with an LH of 7.8 and an FSH of 22.3 and an estrogen level of less than 3 picogram per ml. Identify the diagnosis, the likely diagnosis, and name the genetic defect responsible for the same. Right. So can we have the answer?
McCune-Elright syndrome and genetic defect, genus 1 defect.
I don't think that is the right answer. So can we have the answers from the other teams? Team C.
Team C gets 5 marks. Both
Okay,
answers.
they've given both options right.
Yes.
Team D.
Team D, they have replied. First part is aromatase deficiency. Second is SLC 19A2.
So that is not the mutation responsible.
Yeah, so maybe 2.5.
Yeah, they'll get 2.5. Yeah. And Team A.
Ma'am, they have not answered. So
Okay.
no.
So Team A will not get any marks for this. So the answer was aromatase deficiency and the genetic defect responsible for mutations in the CYP19A1 gene for this. Right. So we move on to the direct question to Team C. So this is a 5-year-old child who presents with hypocalcemia. The lab parameters are calcium of 6.6 milligrams per dl, phosphate of 5.8, PTH of 1.29 picogram per ml, and a vitamin D of 78 nanogram per ml. She has dysmorphism, intellectual disability, and a history of recurrent infections. Radiographs reveal thickened cortices of long bones without splaying or fraying. What is the likely diagnosis? And what is the likely endogenous cause for these recurrent infections? So Team C, can we have the answer?
Ma'am, the answer is Dijot syndrome, and the endogenous cause for recurrent infections is a TBX1 defect, which results in T cell immunodeficiency.
Okay. Dr. Vijay Kumar, do we give that? But
No.
I'm sorry. I'm sorry.
Yes.
There is one clue which you have missed
Yeah,
in the
that thickened
case
cortices.
description about thickened cortices of long bones.
That
So
would
I'm
happen.
sorry, that is not the right answer. Team D, have they answered it correct?
Yes, ma'am. So team D may be partial, Kenny-Caffey syndrome, and the second part they've answered is leukopenia.
No, so the second part is incorrect, but they'll get 2.5 for the diagnosis of Kenny-Caffey syndrome type 1, right?
Yes.
Team A?
Incorrect, ma'am. 0 marks.
Okay. And Team B?
Incorrect, ma'am.
Okay, so only Team D would be getting the partial marks for the first part. So what Team C missed was there was a clue in the radiograph that we had added to specify that we were looking at other causes of hypoparathyroidism here.
Yeah.
So Team D, the direct question to you. This is a 9-month-old baby who's brought with generalized edema. The baby has got ambiguous genitalia with palpable testes, and the karyotype shows 46XY. The lab reports shown are with a hemogram of 10.2, serum albumin 2.3 grams per deciliter, SGOT and SGPT are 43 and 38 international units per ml. The urinary protein creatinine is 2.67. The baseline serum cortisol is 6.9 microgram per dl, and a 17 OHP tested is 1.8 nanogram per dl. So based on these clinical and lab parameters, what are the two likely diagnoses? Right, so the time is up. Team D.
Ma'am, these are defects due to WT1 gene defect. So it can be either Dennis-Drash or Frazier syndrome.
Yeah, so both options, both diagnoses are right. The gene responsible here that we are talking is the WT1 on the Wilms tumor gene. And these two are the likely diagnoses that we were looking at. So they get full 10 points for the direct question. So at the end of round 2, before we go on to round 3, do we have the scores? Team A, Dr. Ayush?
Ma'am, 10 marks.
Okay. Team B?
0 marks, ma'am.
Okay, they are yet to open their account. So
yes.
Good luck to Team B for the next round. Team C?
7.5 for both rounds together.
Okay, so close to Team A. And Team D?
Team D, second round, they have 15 marks.
So overall, they are leading with?
Overall, 25, 10 and 15, so 25.
Okay, so they're leading with 25 for now. So rest of the teams, best of luck for the remaining rounds. We'll start with round 3, which is the round on imaging. And again, the order would be A to D. So Team A, the question for you. This is an image, a radiograph of a toddler who is presented with joint and bone pains. Mention one hallmark radiological finding in this X-ray, and what is the likely diagnosis for this?
And
Yeah, so the time is up. Yes, Chime.
Ma'am, bone resorption causing acro-osteolysis.
Okay.
And for the second part, we are not sure, but I would try the answer as subcutaneous fat necrosis of the newborn.
Okay, so I thought that this X-ray would not resemble that of a newborn, but I think we can award them 5 marks for the hallmark finding on the X-ray that they picked up. Vijay Kumar,
Yes.
sir?
Yes, sir. Yes.
Yeah. So if you can see that there is osteolysis and there are a lot of calcifications around the joint capsule. There are a lot of osteopenia that we see here. So this is hyperparathyroidism. So you get 5 marks for the first part here. And they've answered it partially, so we will not invite any marking on past question here. So the next direct question to team B. This is an X-ray of a 2-year-old male who is presented with history of fasting hypoglycemia, short stature, and failure to thrive. Examination shows hepatosplenomegaly. The labs show calcium of 8.5, phosphorus 2.2, ALP of 780. Potassium is 3.1 milliequivalents. Bicarb is 16. PTH is 56 picogram per ml. And the urinary calcium creat ratio is 0.24. Mention any one likely diagnosis and one confirmatory biochemical test for the renal defect. Yeah, so the time is up. Team B, what's your answer?
Is it digital RDE, ma'am? With urine pH?
No, there are a lot of other clues in the clinical phenotype that should suggest you a better likely diagnosis. So we will go on to the markings for the other teams. So team C, have they been able to answer it right?
Sorry,
C.
it's yeah, they answered Fanconi-Bickel syndrome correctly, but second answer was urine for reducing substances. So I don't think that will fit in. So we're looking for yeah.
Yeah, so they get 2.5.
2 point.
D, team D.
For team D, Fanconi-Bickel syndrome, that's right. The second part is urine glucose.
No, so even that won't get any marks for that. Team A, only 2 points.
They have not answered, so no
Okay,
point.
so the confirmatory biochemical test here, knowing that this is a picture of an RTA, whether this is proximal distal or whether this has progressed to both, we were looking for a biochemical test which would differentiate those in terms of fractional bicarb excretion or an ammonium chloride loading test. So 2 teams get 2.5 for the first part here. Okay, we now move to team C. The direct question in the image is shown here. So this is the MRI of a child performed who presented with poor growth. You have to identify the abnormality and what other defect is likely to be associated on cranial imaging in this child. Right, so the time is up.
This is pituitary stalk interruption with hypoplastic anterior pituitary, ectopic posterior pituitary, and absent stalk. And the other defect which is likely to be associated is an absent septum pellucidum, but other midline defects such as corpus callosal agenesis may also be seen. Or optic nerve hypoplasia.
Right, so you get full 10 marks for answering both parts correct. So 10 points to team C for their direct question. Right. So we now move to the direct question for team D. So this is a 2-month-old baby who's presented with leg swelling and ulcer. There is no fever, dysmorphism, organomegaly, or skin changes. There is history of hypocalcemia that was treated during the newborn period. The current serum calcium is 9.3 with a phosphorus of 3.2 milligrams per DL, alkaline phosphatase of 445, and a pTH of 32 picogram per ml. So what is the likely diagnosis? And name the topical treatment for this condition. So can we have the answer, team D?
Ma'am, there are ectopic calcifications in the X-ray.
Diagnosis.
Is it meloriostosis?
So that's the incorrect answer. Team A, have they answered any part correct?
No, ma'am.
Okay. Team B?
Incorrect answer, ma'am.
Okay. Team C?
Incorrect.
Right. So team D was close to seeing the calcifications here, and with the history of hypocalcemia during the newborn period, this was a abnormal calcification. So calcinosis cutis, which is now presented, and this likely cause being iatrogenic. So most of them would resolve on conservative treatment, but here the topical drug that has been mentioned is sodium thiosulfate, which will increase the calcium mobility when applied. So none of the teams answered this correctly, right? So while we get the scores for the first 3 questions, do we go ahead with the audience question? But I'm not sure whether we'll be able to see them responding on the chat. We'll try the first question. Before that, do we need the scores first? Team A at the end of first 3 rounds?
Yes.
Yeah.
At the end of the first 3 rounds, the total score is 15.
Okay. Team A is at 15. Team B?
Team B is still to open their account. No score till now.
Okay. Team C?
Team C is 20.
Right.
Total
And Team
score.
D?
Team D is 27.5.
Right. So the rest of the teams have caught up well. Team B, best of luck to you. I think we can try one question from the audience. I did see.
Ma'am, I think you have to tell them to answer in Q&A.
Okay, so they can answer in Q&A, and I will request Ankit to enable the Q&A now. And give me a heads up if that is done. Let me know, Ankit. When you say yes, I'll move to the next slide.
Yes, ma'am, you can.
Right. So the audience can attempt this. So this is a 12-year-old girl who's presented with firm, hard forehead swelling. You have to identify the radiological abnormality and what is the underlying pathophysiology that can result in this. I will not be able to see the Q&A perhaps. So can I request my Quizmasters team to see if somebody has answered? I'll stop the timer at the end of 1 minute.
Okay.
Thank you.
I think one person has answered.
Okay.
McCune
Right, so-
Albright.
Yeah, so this is Matthew.
But I don't know his name. Another person was also correct answer. She had Dr. Reshma.
Answers
McCune.
are coming in chat box.
Yeah.
Okay, so then
It is
I
coming
think-
in chat box. McCune Albright GNA's mutation. Reshma.
Right. So this is the second question, sir. The slide just got projected, and I think I'll leave it for now for the audience to answer again. So this is a technetium scan of a baby, which was done after abnormal blood test on newborn screening. So please identify the abnormality and the half-life of the radioisotope used.
Answers Dr. Pamali Nanda. Lingual thyroid, 6 hours. I think that is correct.
Yeah, that is the correct answer.
Correct.
Dr. Reshma, lingual thyroid, 6 to 9 hours. That also may be correct.
Yes.
There are several people who have answered on the Q&A also.
Q&A also.
Yeah. Riddhi, lingual thyroid. That is
Right.
3 in the chat box. Q&A.
Okay.
Kavya,
Yeah.
Vedita, Aman, and then Aman.
Right. So at least our audience is equally is participating in full swing. Nice to see that. So the third question is here. This one is simple. So this is an 11-year-old girl with scoliosis, no back pain or tenderness, no illness, no prior illness or medication use. So looking at the X-ray, what is the likely condition and the treatment?
Haven't received any answers so far.
Oh, I thought this was simple. Anyways, I'll wait for 5 more seconds.
No.
Right. So any from the
Okay,
any
yeah,
of the
we
team
got one
members?
answer.
Okay.
Juvenile osteoporosis.
Yeah. So juvenile
Collapsed
osteoporosis.
vertebral body.
Yeah.
Right.
So Zol, it's the half of Zolendron class.
So we'll give it to whoever has answered it right.
Yes,
Thank you. So I'll request Ankit to now disable the chat and the Q&A now, so that we move ahead with the 4th round of the quiz.
Done, ma'am.
Right. So we did have the scores till we'd already seen the scores so far. So we'll move to round 4, which is Sir, Dr. Vijay, sir.
Hello. I think we can start.
Yes, sir.
Yeah.
I
think
there is some
somebody's-
background noise. That is why I thought.
Ankit is the one.
Ankit.
Okay.
Sorry, ma'am.
Right. That's okay. So we'll move to drugs and therapeutics round. And for this, the sequence would be reversed. So we'll have the first question to team D now. So team D, I hope you're ready for the first question here, right? So the direct question comes to you. So what is the duration and the dose of corticosteroids that have been defined as short-term glucocorticoid therapy, which has a low risk of HPA axis suppression as per the Endocrine Society Guidelines 2024? So you have to tell me the duration and the dose. Okay, so the time is up. Team D.
Ma'am, duration is 4 weeks and dose is less than 10 mg per meter square per day of hydrocortisone equivalent.
So I'll give the first part to you. So the duration is any duration which is less than 3 to 4 weeks. So you were almost like 4 weeks, up till 4 weeks is okay. But the dose is not the dose that you are talking about. The guidelines say that with this duration, irrespective of the dose, it can be treated as a short-term glucocorticoid therapy. And this does not need any tapering or testing for HPA axis to stop the steroids. So you get 5 marks for the direct question here. Next direct question to team C. What is the commonest endocrine abnormality after hematopoietic stem cell transplantation? And name the drug most often used for pre-transplant priming that is responsible for this endocrine manifestation. So both parts to be answered. Yeah, so the time is up. Team C.
Ma'am, the drug which is used pre-transplant priming is cyclophosphamide. The most common endocrine abnormality after a stem cell transplant is hyperglycemia.
Both parts are incorrect. Sorry. So team B, have they been able to score any of the parts correct? Dr. Jala?
Team D is incorrect.
Okay. Team A.
Ma'am,
Dr. Ayush?
they have given one part correct. That is hypogonadism is the most common side endocrine abnormality, but the
Right.
other part is wrong. So they will be awarded 2.5.
Correct. And team B?
Incorrect, ma'am.
Okay. So the drug which is most often implicated is busulfan in this case. So team A would be getting 2.5 for the first part here. Right. So now team B, the direct question to you here. Name the oral drug approved for use in pediatric type 2 diabetes apart from metformin, and any one contraindication of its use as an anti-diabetic medication in children. So can we have the answer, team B?
It's empagliflozin, and urinary tract infection is the contraindication for using for anti-diabetic medication.
So the first part is correct, but the second part as UTI is incorrect. So it is not a contraindication. It just has to be little cautiously used if there's an UTI. So I'll give you 5 marks for the first part, which is empagliflozin. And the contraindication is actually mentioned as are only two, which are diabetic ketoacidosis and chronic kidney failure. So you get 5 marks for the direct question here. Right. So team A, the direct question for you now. What is the mechanism of action of fenofibrate in hyperlipidemia? And name a significant drug interaction that limits its concurrent use with statins in the treatment of primary hyperlipidemias. Right, so the time is up. Team A.
Ma'am, fenofibrate is used in hypertriglyceridemia. It will inhibit the action of lipoprotein lipase. And regarding drug interaction, we're not sure.
Okay, so I think we can give them 5 marks, Vijay Kumar sir, for the first part that they've answered.
Yes, 5 marks we can keep.
Right. Any
Ashima, first part I might have misheard. They said inhibits the lipoprotein lipase.
Okay, so yes, sorry. They said inhibits lipoprotein lipase, so they will not get any marks for this question at all. So it would be activating the lipoprotein lipase by acting on the PPAR receptor.
Okay.
And then there would be, that would increase the HDL and the chylomicron clearance. The significant drug interaction, any other team who would want to attempt that? Has anybody else got it? I mean, they in any case.
Team C gets both correct.
Okay, team C gets both. So they get 5 marks.
Yeah.
Team
So
D, myopathy, the second part. First part decreases VLDL synthesis from liver along with decreased peripheral lipolysis.
That is very vague. I don't think we can give any marks for that part, but yes, we can give 2.5 marks for myopathy.
Yeah. Okay.
Team A.
Team B has an incorrect answer.
Okay, so so the drug interaction very specific was rhabdomyolysis or myopathy, and there are specific scores that are now there to score patients for muscle symptoms when they are on statin and fenofibrate therapy both, mainly applicable in drugs. But yes, that's a drug interaction that has to be watchful and carries a black box warning. Okay, so at the end of round 4, can we have the scores before we move to round 5? So team A is at what score?
Totally 17.5.
Okay, team B.
5 points.
Right, team C.
25.
And team D.
35.
Okay, so team D is still maintaining the lead. So best of luck to the remaining teams. We have 2 rounds, and the round 6 is going to be pretty scoring. So again, in this, the sequence remains D to A. So the first question to team D, the direct question. So this is a 7-year-old girl who presents with short stature. The eye examination and the skeletal imaging is attached. What is the likely diagnosis? And name any associated endocrine condition. Right, so the time is up. Team D.
The likely diagnosis is cystinosis leading to RTA, and the associated endocrine condition is hypothyroidism.
That is not the right answer here. Team C, Team A, have they got it right?
No, ma'am.
Okay, incorrect. Team B.
No, ma'am. They have mentioned Lish nodules, but not the diagnosis.
Vijay Kumar sir, do we give them 2.5 for that?
No.
No.
No, because we asked the diagnosis, right?
Yeah.
Team C, have they
Team C
scored
gets
any?
both correct.
Right, so they get 5 points. So these are the Lish nodules, yes, but this is the diagnosis is neurofibromatosis 1. And the endocrine condition, anyone could be a pheochromo or precocious puberty, and sometimes rarely only isolated gynecomastias can also be seen. Right, so we now move to the direct question for Team C. So this is a 15-year-old boy with short stature. The clinical phenotype is shown. Identify the condition and that in terms of diagnosis, and name any one associated radiological feature. Yes, Team C, can we have the answer?
The diagnosis is Ellis-Van Creveld syndrome, and the radiological features are carpal fusion and mesomelic limb shortening.
Yeah, so I think we can give it to you as full 10 points. So this is Ellis-Van Creveld, which is a chondroectodermal dysplasia. And apart from the metacarpal fusion that you've mentioned, they could be trident ilia, or they could be abnormal cone-shaped epiphyses and short ribs. So yes, mesomelic dwarfism had mentioned. So full 10 points to you. We now have Team B, the direct question to you. So this is a 5-year-old girl with limb deformities. The slit lamp examination is shown. What is the likely diagnosis and the treatment of choice? for this condition. Sorry, the eye cover has just not shown up here. Apologies for that. Right. So can we have the answer, team B?
Ma'am, cystinosis, the diagnosis, and the drug is histamine.
Right. So you get both parts correct. So this is cystinosis, not the first one. That wasn't a slit lab examination. This is slit lab examination. So you get both parts correct. Cystamine. Right. So we now move to the last question of this round for team A. The direct question is shown here. This is a 13-year-old boy with short stature. What is the likely diagnosis and what is its inheritance pattern? So time's up. Team A, your answer?
I think it's a glycogen storage disorder.
That is incorrect, team A. If that is incorrect, then obviously the second part can't be given any marks. So do we have the answers from team B, Dr. Akanksha?
Incorrect answer, ma'am.
Okay. Team C?
Incorrect.
Team D?
Incorrect.
Okay. So this is, if you can make out, can you see these projections here in the X-ray? These are very, very conspicuous everywhere, right? Even here. So this is hereditary multiple exhaustosis. May not be very clear in the phenotype. You may not be, you're not expected to see it here, but these are very clearly visible here. And the inheritance pattern here is autosomal dominant. So none of the teams get this correct. So at the end of, I think we can ask our quiz masters to compile the score. Until then, we can give a breather to the audience. So the Ankit, I request you to enable the chat, and this is the first question for them. This is a 4-year-old boy who's presented with precocious puberty and rapid weight gain. And there is a radiograph, CT scan image, a radiograph of the abdomen shown. So they have to tell us the diagnosis. Okay, so we have some answers. Now I can see the chat. My quiz masters are busy compiling the scores. Yes, so
you can see the chat.
Yes, sir. Now I just clicked that option.
Adrenal tumor,
Yes.
adenocortical carcinoma,
Yeah.
ACC.
Yeah.
Dr. Reshma, Dr. K, Riti, Sruti.
Yeah. Right. So this is right. We can stop the timer and move to the next question here. So this is the radiograph of bilateral knees shown. Describe any two observations that can be seen and the diagnosis here. So the findings are correct for most. So something in addition to rickets is what we were looking at the diagnosis. Yeah, so I think Dr. K has answered as healing rickets. So yes, I can stop the timer here again. So in addition to all those findings of rickets, what you also see are these white lines. Yes. So thank you. We'll move to the next question. I think I have one more for the audience here. Again, a simple one. This one is going to be simple. So identify the skin lesion and the likely diagnosis. So we have an answer here. Yes, so these are xanthomas. So typically tendon xanthomas, and the condition is a homozygous familial hypercholesterolemia, right? So thank you. I think we can now, Ankit, I'll request you to close the chat option now, disable the chat. And before we move to the last round, we will like to know the scores here. So team A, Dr. Ayush, what is the score of team A so far?
17.5.
Right. Team B?
15 points.
Right. Team C?
40 points.
And team D?
35.
Okay. So team C has actually overtaken team D after the end of round 5. And I think now I'll hand over to, I'll stop share. I'll hand over to Dr. Ayush, the quiz master for the rapid fire round. Over to you, Dr. Ayush.
I hope my screen is visible.
Yes, it is.
Yeah. So it is in slideshow.
Yes.
Yeah. So moving to the next round, that is the rapid fire round. So these are the rules. Each team gets individual set of 10 questions each. Total time allotted for the whole is 2 minutes. Each correct answer scores 1 mark and there will be no negative marking. Answers to be spoken for each questions after the end of the question. The team should mention pass for the next question to be asked. The first response from the team will be marked as the answer. Any further response will be invalid. Teams can return to unanswered questions in the remaining time. The round does not allow any questions to be passed to other teams. I hope the rules are clear to everyone.
Sir, excuse me, sir.
Yes.
If we answer any question wrongly, can we reattempt it?
No.
Thank you, sir.
Only if you say pass, you can reattempt.
Okay. So the sequence will be again from team D towards team A. So I hope team D is ready. Team D is ready. Yes or no?
Yes, yes.
Okay. I'll restart it. 1 minute. Okay. In children, LS secretion does not occur until puberty. True or false?
False.
Correct. Glucose transport present in the pancreatic islet cells.
GLUT2.
Correct. Name the hormone in HPT axis which does not cross placenta.
TSH.
Correct. Which assay can be used instead of HbA1c in individuals with hemoglobinopathies?
Fructosamine.
Correct. MODI that shows hypersensitivity to sulfonylurea.
HNF1 alpha.
Correct. Hormones responsible for fetal growth.
Insulin, IGF-1 are the main ones. Then
Which is your first answer? Please tell me.
insulin.
Incorrect. Enzyme deficiency in apparent mineralocorticoid excess.
11-beta HSD2.
Correct. Clomiphene citrate challenge test is done for.
Ovulation induction.
False. Collection of data is an authorship criteria as per ICMJE. True or false?
False.
Correct. One non-parametric test for two group comparison. Time's up.
Can we answer? Man Whitney.
No, the time is already up. So they have answered 7 out of 10.
Yes.
Moving to team C. Are you ready?
Yes, sir.
Okay. DHEAS levels are lower in neonates than infants. True or false?
False.
Correct. Glucose transport present in muscle cells.
GLUT4.
Correct. MODY associated with developmental renal abnormalities.
MODY5, HNF1 beta.
Correct. Net effect of a food or a meal on blood glucose.
Pass.
Metarapon test is used for diagnosing.
Pass.
Nutritional deficiency that results from intake of metformin.
Vitamin B12.
Correct. Inactivating mutation of GNAS gene causes.
Pseudohypoparathyroidism.
Correct. Next, formula for calculating free androgen index.
Testosterone divided by SHBG into 100.
Correct. An interventional trial can be registered after the study begins. True or false?
False.
Correct. A statistical test to compare two group paired discrete data.
Before after t-test. Discrete t-test for normally distributed data, t-test for before after comparison.
Incorrect. Coming back to net effect of a food or a meal on blood glucose.
Increase.
False.
Increase.
Metarapon test is used for diagnosing.
Metarapon, hyperaldosteronism. Hyperaldosteronism.
False. So they have answered 7 out of 10. Ma'am, am I right?
Yes.
Yes.
7 out of 10.
So coming to team B, are you ready?
Yes, sir. Yes, sir.
Okay. Predominant LH response is seen in premature adrenarche. True or false?
False.
Correct. Glucose transport present in brain glial cells.
GLUT3.
False. Hyperthyroidism without uptake in technetium 99 is seen in
Thyroiditis. Thyroiditis.
correct. Clonidine suppression test is used for
Growth hormone stimulation. Growth hormone deficiency.
incorrect. Conditions with type 1 diabetes, dermatitis, enteropathy, hematological abnormalities.
IPEX.
Correct. GH therapy can be stopped if growth velocity is less than
Pass.
mineral required for apoptosis of hypertrophic chondrocytes.
Phosphate. Phosphorus.
MODI associated with insulin requirement in pregnancy.
GCK2, MODI 2.
Correct. Verbal assent can be taken from 9-year-old child for participation in the study. True or false?
False. False.
Correct. Statistical procedure for estimating survivor over time.
Pass.
Coming back to GH therapy can be stopped if GH growth velocity is less than
6 centimeters per year.
Incorrect. Statistical procedure for estimating survival over time.
No idea, sir.
Okay. So they have answered 6 questions out of 10 correctly.
Yes.
6 questions.
Okay. So team A, are you ready?
Yes, sir.
Okay. Kisspeptin directly stimulates the GnRH neurons. True or false?
True.
Correct. Glucose transport present in placenta.
Pass.
MODI that shows significant low levels of hsCRP.
Pass.
Maximum permitted dose of diazoxide in congenital hyperinsulinism.
2.4 milligram per kg per day.
Incorrect.
20.
Saline infusion test is done for. Saline infusion test is done for.
Diabetes insipidus.
Incorrect. Recall level of TSH in newborn screen according to ISPAE guidelines.
Pass.
Pituitary hormone that affected last in the acquired condition affecting pituitary.
ACTH.
Correct. Which algorithm is used by Medtronic 780G?
Pass.
Name the reporting guideline checklist for systemic reviews.
Consort. Prisma guideline.
Incorrect. The first answer was incorrect. Graphical technique to check agreement between two quantitative variables.
Technique.
Bland-Altman plots.
Correct. Coming back to glucose transport present in placenta.
Pass.
MODI that shows significant.
Pass. मला हे द्यायचं होतं NBS.
They
80.
have answered 3 correct. Out of.
Yeah, 3.
Okay. So we are coming to the end of our quiz. So before we collate and announce the final scores, I would like Dr. Rahila to come and introduce the modules for pediatrician as well as the ISPAE diabetes registry. Over to you, ma'am.
Can we have those slides?
Yeah, I'm just going back.
Okay, okay.
Over to you, ma'am.
Good evening, everyone. Please pardon me for my horrible voice. I'm croaking, but I didn't want to leave my tenure without croaking. So it's a pleasure. And we've had a wonderful team over the last 2 years. And we've worked really well as a team. And we've had some wonderful work being done by our team. I would like to acknowledge the amount of effort put in by 3 senior mentors and led wonderful team to prepare modules in growth, thyroid, and management of type 1 diabetes. The growth monitoring and short stature module team was led by Dr. Vaman Kadalkar, Dr. Ayush Gupta, Dr. Diksha Shirodkar, and Dr. Anshika Singh have contributed enormously, and these modules are available for all ISPAE members to use it in meetings to improve and help the practice of practicing pediatricians in the periphery. These modules will be with ISPAE EC, and anybody who wants to run a program can do it as a program. We have planned the growth monitoring and short stature along with thyroid disorders to run as one module, which can last from anywhere from 2 to 4 hours based on the audience that you're going to use these modules for. It can be used in any part of this country. We have also spoken to our IAP, our esteemed IAP team led by Professor Vasant Kalatkar and his wonderful team, and our ISPAE members in association with the local IAP can use these modules. The thyroid disorders in children, the module has been readied under the guidance of Professor Raghupati with wonderful contributions by Dr. Mahesh Maheshwari, Dr. Amarnath Kulkarni, Dr. Mugdha Todkar, and Dr. Vaishnavi Agrawal. These modules are all designed to help pediatricians to look after these children, and basic needs of these children with growth and thyroid disorders can be managed with the help of the modules after they've undergone this module course. We also would like to thank Professor ISPAE Irani for leading the team for the management of preparing a module on management of type 1 diabetes. All of you know the work being done by IDEAL team and the IDEAL course. That is an extensive and a complete preparation for you to manage your patients. But management of type 1 diabetes as an initial introduction to it, these modules will be helpful for regular pediatricians. And I think our thoughts behind preparing this module is that the care of children with type 1 diabetes should move away from adult and diabetologists to our pediatricians who have so much of personal touch and contact with these families who are diagnosed with type 1 diabetes. So Professor ISPAE Irani, with his team of Dr. Rakesh Kumar, Dr. Akanksha Parikh, Dr. Zalak Upadhyay, and Dr. Abraham Paulos had prepared an excellent module. This will also have some part of hands-on experience for all of you. These modules can also be sponsored. We would try to sponsor at least a minimum amount through the help of some pharmaceutical companies. The Pfizer India Limited have agreed to help in the implementation of modules for pediatricians on growth monitoring and short stature. And the management of type 1 diabetes module, we also have asked for a non-restrictive help from Medtronic, and they will provide support to run the program, and all of these will be minimal support will be given for the teams which would like to conduct these modules. We hope all of you use it, and I'm sure the new team led by Dr. Anurag Bajpai, Dr. Ravindra Kumar and his team will take it ahead, and along with the IAP, we hope to reach to pediatricians in every corner of this country to improve care of children with these endocrine disorders. Thank you so much for the wonderful work by the team, and I know they've devoted almost a year to prepare these modules. Thank you so much for the teamwork from Dr. Vaman's team, Dr. ISPAE's team, and Dr. Raghupati's team. Thank you so much. We
And
also
ma'am,
have, I'm going to introduce.
To announce this open to everyone.
Yeah, and I would like to, we are very, very, very happy and deeply thankful that we have been able to initiate the diabetes registry for children. This is called ISPAE Pediatric Diabetes Registry. We are trying to collate information for children with diabetes in this country so that we could ask for help from the government and other NGOs to help these families manage and deal with pediatric diabetes registry. Though several world atlases say that India has the highest number of children with diabetes, we have never been able to collect data to offer authentic information. This has been an extensive work. Huge amount of work has gone in over the last 2 years to prepare this registry. And Dr. Ayush Gupta will take you through on how to use it. All of you are welcome to write to the email ID, which Ayush will highlight. You will be given permission to use this team after being approved by 2 members from the IPDR team. And Ayush, thank you so much. And I'm looking forward to watching this along with all of you. Thank you.
So this ISPAE diabetes registry, I'll just go through the steps for everyone. So you just you have to just go to ispaediabetesregistry.com. Once this web page opens, so this is the main web page, which tells you what are the aims for establishing this diabetes registry, and this is the core team. Then we have been doing cross checks over a period of last 1 year to see whether any bugs have been there or not. And now we are ready to open the system to all the ISPAE members. So once you log in to the ispaediabetesregistry.com, you just have to click on join IPDR, which opens up a registration form in which you have to enter your particulars, that is your name, your institution name, then whether you are working in government, private, semi-private or charitable setup, and then you have to enter your mail ID, contact number, and you can there itself put in your own password and send a registration request. This registration request will be approved. We are having that approval so as to avoid any undue breach of data, and only authenticated persons are able to enter the data. Once you receive a mail that your registration request has been approved, you can just log in and then log in with the credential you have already created yourself. And then once you open it, this is the dashboard which opens up. So there is a list of all the patients which is there, but you will not be able to see the data which has been entered by the other doctors. You can only see the data which you have entered. If you want to add a patient, just click on add new patient, which opens up the initial performa, in which the essential things which need to be entered is the name, the state, the district, and the contact number, so that the duplication of data can be avoided. And then all the initial visit data can be entered. Once you enter it, then this is how it will look on in your dashboard. You can even search that patient with the name or their IPDR number, and all the follow-up visits, you can add up the follow-up data. So we have a extensive follow-up performa, which take cares of all the hypoglycemic episodes, any other investigations you do, any long-term side effects are there. And then this data can be entered periodically, so as you build onto this IPDR registry. If any feedback is there or any other suggestions or any problem is there, you are free to contact any of the core members and we will be happy to help you out. Thank you. So handing back to Ashima ma'am. Ma'am, should I stop sharing?
Yeah, you can stop sharing. I've just entered the final scores. I'll just share that screen. Right, so people who were keeping tab of the results. So it was an interesting quiz. I'm sure all of us would have enjoyed it. So we have team A at 20.5 marks, team B 21, team C leads, and I think the last 2 rounds were magical for them where they outrun team D. So team C from AIIMS New Delhi, Dr. Sukanya and Dr. Konpal, they are the winners, and I would request Dr. Vijay Kumar, Dr. Ahila ma'am, Dr. Rakesh sir to kindly congratulate all the teams. So Dr. Vijay Kumar first, sir. I can stop sharing here. Dr. Vijay Kumar sir.
I think it's not there.
Sir is not there? Must have just dropped out. Ahila ma'am, I think you can begin.
Yeah, I'm sorry. I didn't know most of the questions. So for the teams who did not score or who felt bad, don't feel bad. I think most of our attendees would actually have scored less than you. it is just I mean, it's just a part for you to generate interest in pediatric endocrinology. It does not measure your expertise or your dedication in pediatric endocrinology. So I would start off actually by congratulating all 4 teams for reaching this level and for being a part of the finals. And I'm also very, very grateful to all the teams who participated in the initial round also. For the team who won, you were stupendous. And anyway, I think even if we had competed, we would have actually fallen by the wayside very early on in the competition. Best wishes, congratulations to the team from AIMS Delhi. And it was like what do you say? A last over victory for you. You ran over the team from PGI. And I think there might have been a little bit of anxiety in Arun and Sayan waiting to see whether they can. Oh, you didn't think so? Okay, that's fine. Anyway, congratulations to team from AIMS Delhi and for Arun and Sayan for putting up such a stiff fight to see that they also had to run fast to, surpass you and get to the post. But still, I feel all the teams have done extremely well. And the luck of the draw also would have made a change for all of you. Wonderful, brilliant, and best wishes for all of you for a wonderful career. Thank you so much. And I'm deeply, deeply thankful to Ashima, Ayush, Zalak, Akanksha, and Sirisha for the wonderful work. And I think you must have put in hours and hours of work to get us here. And I'm deeply thankful to Rakesh and all my EC members for the last 2 years. I could not have asked for a better team. Rakesh has been like a rock and a pillar and has been so very supportive. I think I will carry memories of this team forever in my life for the wonderful a team spirit that we had shared and the love and the dedication to job I've learned from all of you. Thank you so much. And I wish you all the best in all of you for your future too. Thank you.
Thank you, ma'am. So I think, Doctor, we have a few senior people in the attendees also. If anybody would want to convey their wishes, please feel free to use the chat option. Ankit can open the chat. Dr. Rakesh, any closing comments from you, sir?
Yeah, obviously, big congratulations to the winners and the participants, obviously. Team A and B also, I think, caught up later. And yeah, so congratulations to the winners, Team C, Dr. Konpal and Dr. Sukanya. Good job. And Dr. Arun and Sain, yeah, I must say, you made us proud. Being there is the first and foremost thing, being participating there actually, and then winning the round, even second runner-up or first runner-up is good enough actually. Yeah. So quiz questions were actually quite balanced this time. I think they were not very easy and some were a bit tough. Yeah. So it was quite balanced, I think. Thank you very much, Dr. Asima and team, for doing this. And thank you, Dr. Rahila, for the support. Yeah. So this is actually sort of our closing of Executive Council as well for last 2 years. We have been working really well as a team. And thank you, Dr. Rahila, for all the support and guidance you provided to me as a secretary and the other executive members. Dr. Sirisha is here, Dr. Zalak, Dr. Ayush, everyone. They had been really very supportive. Dr. Ashima was part of the team as Cape News editor. So wonderful team and good job, I think. And I'm sure the next team will take it on further. Yeah, thank you. Thank you very much.
Thank you, sir. And I think in addition, I would also want to put it on record that it is just a matter of one question and plus 10 marks of direct answer, which made the difference. So don't lose hope. I think all 4 of you were excellent. And when we were compiling the questions, we literally had to raise the bar because you did just extremely well in prelims. So we had to delete most of the questions which we'd made for the finals. Went back, read, and then put up some difficult questions for you. So as Ahila ma'am and sir has just mentioned, you all were really brilliant. So we have many congratulations messages for all 4 teams in the chat. Thank you, Shaila ma'am. Thank you, Rajni ma'am. I think I did see your messages popping up. And I think a special thanks to all my team members. So Dr. Sirisha, Dr. Jhalak, Dr. Ayush, Dr. Akanksha, because all of them were crucial, were very important, played very important role in putting this all together. And Dr. Vijay Kumar, I think he's just left. With special thanks to sir, because he did we made him do a lot of homework yesterday night in validating our answers and questions. So special thanks to him. I think with this, Jhalak or Sirisha, I think I can hand the stage back to you. And I think we can
have
close.
a closing picture before we end this.
Okay.
Because everyone is
I
there.
already took one, but we can take one more. Yeah.
Yes.
Smile, please. Yes.
Thanks, Shaila. Thanks, Rajni, and everybody who helped us all through this. We're deeply thankful to our advisors, Professor Raghupati, Professor Menon Sir, Dr. Vaman Kadalkar, and our immediate past president, Dr. Shaila Bhattacharya. And I have to be very, very thankful to Ashima for such a lot of work that she had done on Cape News also. Sirisha has been brilliant, and I owe a deep round of thanks. I know I will keep on thanking everyone. Anyway, thanks to all my team. You're all part of my family. Thank you very much.
Thank you so much, ma'am. And it's a wonderful show, Ashima. And then congratulations to all the 4 teams. You literally, like after prelims, we were kind of scrambling for questions. Yeah.
Thank you, RX Events. Thank you.
Yeah, thanks, Zalak, for all this lovely work over the last 2 years. Akanksha, as
you.
usual, I drop everything on your head every now and then. But
Thank you all. I think we can
Yes.
we can close for now. So Merry Christmas in advance.
everyone.
Yeah.
Happy
Bye.
New Year. Bye.
Thank you all who
Good night,
joined,
everyone.
attendees.
Good night.